Thank you, Dr. Neha Kakal. Am I audible?
Yes, doctor. Yes.
Thank you. And now it's the time to start the international session. Today is the 1983rd day of uninterrupted daily webinar of Ifph. Before beginning the session, let's have a silent prayer. Hello, doctors, friends of homeopathy, and students of homeopathy. Today is the 1983rd day of uninterrupted daily webinar of Ifph. And today, our guest is Dr. Harshna S. Goti, consultant physician, Happy Homeopathic Clinic, Labheshwar Complex, Kadargam, Surat. Dr. Harshna worked as an assistant professor from 2022 to present in Vidyapith University, Kim. Doctor attended various seminars like the Vidyapith Homeopathic Medical College and Research Center, Anita, Kim, Surat, and published various articles in national and international journals. Also attended a lot of webinars and is now worked as an executive member for HMI Surat Central Unit since 2022. Do have effective communication skills, leadership abilities, and is having strong inclination towards teaching and continuous learning. Now, today our topic is repertorial insights into major depressive disorder, a path to recovery. Let us welcome Dr. Harshna S. Goti, and I welcome you all for the session. Let me make Dr. Harshna the co-host. Just a minute.
Hello. Can we start, sir?
Yeah.
Okay.
It's visible.
Okay, sir. Hello. Good evening, everyone. Myself, Dr. Harshna Goti, and I'm representing a lecture today upon a repertorial insight into a major depressive disorder, a path to recovery. Moving forward, before we dive into rubrics and remedies, I want to pause on the reality described by the K. Redfield Jameson. She described a depression as a disorder that is mysteriously painful and elusive. As a practitioners, we often look for a logic, but for our patients, it disorder disconnects the self from intellect. It is a suffering that exists the shadows, often beyond the reach of language. So, how do we treat or cannot be described? When a patient says, I don't know how to explain it, they are living this thought. The pain is real, but the words are missing. That's the question we will answer today. We will look at how repertorial insight allow us to hear what isn't being said, to map the uncharted territory of their moods, and to guide them out of the elusive darkness. And the Dr. K. Redfield Jameson says the depression is a disorder of moods, so mysteriously painful and elusive in the way it becomes known to the self to mediating intellect as to verge close to being a beyond a descriptions. Moving forward, under the title of repertorial insight, we must ask what is the true function of the repertory in mental health? It is a barrier, a complex language. The major depressive disorder is manifest as a chaotic mix of sadness, hopelessness, anxiety, despair, and the patient often struggles to articulate this pain, and practitioner faces the challenge of interpretations. And ultimately, the result is the gap between the patient's internal reality and physician's understanding. There is where the repertory becomes our most valuable tool, as a repertory is a translator. It functions as a sophisticated philosophical translator, and it takes a raw confused data of patient suffering and bridge the gap to the remedy. It translates, for example, patient says, I feel empty, into the indifference, I can't cry, into the grief and silence. This translation process is just not the technical, it is the very heart of individualized case. And the outcome is the translation is central to individualized care and transforming the indescribable sufferings into the correct remedy. Moving forward, the understanding of major depressive disorder. There were so many peoples around the world, they are suffering from the major depressive disorder. As a worldwide 3.8% of the people, in India 4.5 to 5.2%, in Gujarat 4.5 to 5.2%. And very common manifestations of persistent sadness, hopelessness, loss of interest in previously enjoyed activities, sleep disturbances, cognitive impairments, physical symptoms, lots of. And here is the definition. Major depressive disorder is a characterized feeling of sadness, hopelessness, loss of interest in daily activity lasting for the least 2 weeks, impairing social and occupational and functions. Next, the depressed mood of cost of the day nearly every day as a markedly diminished interest of pleasure, adenoia, significant weight loss, shift disturbance, psychomotor agitations and retardations, fatigue or loss of energy, feeling of worthlessness, diminished ability to concentrate, to indifference, and recurrent thoughts of death and suicidal ideation. Next, a homeopathic advantages, which is a complementary perspective addressing a resistance, offers a vital solution of treatment. And the totality of principles is focusing on the integration of physical, mental, and emotional symptoms rather than the isolated pathology. In repertorial methods, it's our compass. It gives a structurized framework to navigate the complex, chaotic symptomatology of depression. By this using method, we don't just suppress the symptoms, but we identify the constitutional remedy that simulate the patient's innate healing capacity. That is the only way to truly reverse the pathology. And here's our webinar objective is a classical principle with contemporary psychology, provision of evidence-based strategies, clinical insights, and practical tools to guide patients from darkness to light. Here, first we build a clinical foundation. We cannot treat, we don't understand. So we will review the modern diagnostic criteria and significantly look at where the conventional treatment fails and the resistance and where we step in. Next is a repertorial mastery. Second, the repertorial methodology, you will learn to translate the patient's chaotic narrative into the precise repertorial languages. And the third one is a case analysis and totality. It enhances the comprehensive case-taking skills to capture the totality of symptoms, distinguish between the fundamental and constitutional symptoms and disease manifestations. And the fourth one is therapeutic management. Explore the key remedies, potency selections, define the repetitions and strategy for chronic mental health conditions. And it is also need integrated care. Established collaborative pathways in conventional psychiatries, monitor programs, and assess the risk factor for informed clinical decisions. And the sixth one is ethics and safety. Treating the depression cares high stakes. We will discuss the ethical boundaries to ensure the patients in safe out of their journey, darkness to the light. The growing mental crisis is nowadays increased more a day, more on the world. So global burden of depression intensified the post-pandemic. We all know after COVID, there were lots of cases of depression are increased. And suicide is the fourth leading cause of death among the 15 to 29 years old. And the depression contributes significantly to disability adjust life years and urgent need for diverse, effective, and therapeutic alternatives. What is the limitations of conventional treatment? The first one is a treatment resistant. Despite advance in psychopharmacology, a significant percentage of patients do not respond adequately to the first-line antidepressant medicine and creating a critical challenge in mental health care. And the second one is the side effects and dependency. The common concern include the adverse reactions, dependency potentials, withdrawal challenges that compromise the long-term treatment, adherence the patient quality of life. And the third one is high replace rate. The conventional medications often suppress the symptoms without addressing underlying imbalance, leading to the elevated relapse rates and when treatment is discontinued or reduced. And the limitations create the space for complementary approaches that address the individual holistically rather than merely managing symptoms. We need a patient-centered care demand. The homeopathy gives an individual approach to personalized medicine tailored to the unique constitution and symptom patterns. Next one is minimal side effect. The gentle remedies which reduce the risk of adverse reactions or dependency. Third one is the high replace rate, the treatment that address underlying imbalance, not just the surface symptoms. And homeopathy individualized the methodology, aligns the seamlessly with this growing preference of patient-centered holistic care. And we built by using this data, building a evidence-based, which is a case analysis, consist approach to psychiatric case taking and symptoms evaluations, remedy selections, evidence-based repertorial methods for identifying a constitutional remedy, and outcome is meaningful metrics and documentation for clinical research and advancement. The risk factor for depression, first one is the biological factor. Altered hypothalamo-pituitary adrenal axis, genetic factors, and altered circadian rhythm. The second one is the psychological factors. There is a negative parental influence, separations or early loss of maternal attachments and bond and personality style. Third one is a cultural factor. Religion and caste influences, beliefs and attitudes and cultural interpretations. Fourth one is the socio-economic factors. Poverty, low literacy, modernization, urbanizations, migrations and relationship distress. Natural disasters and conflicts. Here we moving further forward for a case discussion. So there is a first case, the case of a weight of lost power. A 37-year-old male patient studied a bee farm and doing a job in pharma company came with the complaint of depression since last 1 year. At present, last 3 months, the complaint of sadness increased, mostly aggravated in the morning on waking. Mood changes frequently, difficulty in concentrations, weeping, tearful mood, especially at 4 to 8 p.m., feels restlessness at evening. He cannot do his work, had to come back home at evening. For that reason, he has a fear of losing position in his company. Constant thoughts running in mind, confusion of mind at evening, and sleeplessness midnight after 2:30 a.m. And the patient has an associated complaint, which is had a pulsating type of pain in general, which is aggravation by external pressure. Gastric trouble is a sensation of fullness after eating in stomach, feels better by irritations. Past history, cholecystectomy done 5 years back, and no any other major illness were found. The family history, father is alive and healthy, but mother is alive and healthy but having a complaint of insomnia. I tell you one thing about this patient. This patient, whenever they come in the clinic, he sit with the attitude like this and saying, you know, doctor, I have a problem of depression, sadness. I cannot sleep till midnight in early morning. And you know, I am the manager of the pharma company, you know, but because of that, my issues, I have to lose my post. And after that, I have a very big fear to losing my post and losing my power, positions also. There is a identification while a clinical case taking of facial expression of patient. Moving forward, a personal history, a physical journals, the patient having a appetite, ravenous hunger, increased appetite after eating. Patient said, you know, doctor, I am eating a full meal after eating a full meal. And the thirst, 1 to 3 liter per day. Stool, occasionally suffering from flatulence, otherwise no any problem found. Urine, pale yellow, craving too much of sweets. aversion not specific, thermal reactions, hot patients, sleepless midnight after 2:30 a.m., perspiration in general order, no straining, addictions, tobacco chewing, this allergy, no, and the professional details, manager at a pharma company. Socioeconomic status, middle class, and marital relation was good. Next is obstetrogynecal not applicable, and in life space and mental symptoms. Patient says, I am the first child of my parents, belong to a middle class family. I reached the highest position of my life. Childhood was normal like other children. Good in study, easy to get job, doing too good in my job, got married at age of 28, living happy married life, having 2 children. Everything was good. But in last 4 years ago, I had some dispute with my senior in company and I lost my job. I got another job, but due to that, I lost my position of power of manager and I am a employee right now, which I can't handle it. I want a power of positions and I have intolerance of contradiction. I can't tolerate anyone to oppose me, and especially in my workplace, I can't do handle. I obey or dictate the employees. You have to do this, you have to do this. But if someone dictate to me, I can't bear. Next to a physical examination, patient was conscious. General appearance is melancholy and lethargy. General weight and nutrition well built. Height is 5.9 inch. Anemia, no. No cyanosis. Weight is 86. Jaundice absent. There is no pigmentations, no edema. Pinkish nails, steady gait. No any lymph node enlargement. Blood pressure is okay, 120 by 80 millimeter of mercury. Pulse is 78 per minute. Then we go further a systemic examination. Normal respirations, cardiovascular system, nervous system, gastrointestinal system, genitourinary system, locomotor, all fine. No any abnormality detected. But the physician's observation during my case taking, the patient's haughtiness in conversations. No need of any laboratory investigation. So the provisional diagnosis, according to the complaint of patient, is a major depressive disorder, which is differentiated with the major depressive disorder, and the final diagnosis is moderate major depressive disorder. You see here, a provisional diagnosis is major depressive disorder, differential diagnosis is major depressive disorder, but final diagnosis we use a moderate major depressive disorder, which is based on Hamilton Depression Rating Scale, which is doing a questionnaire Hamilton Depression Rating Scale, and the scale is 14, which is classified under a moderate major depressive disorder. So we can further a case procedure. Analysis of case. Patient has a sadness, 3 marks, morning on waking, which is characteristic mental generals. Changeability in mood, common mental generals. Weeping, tearful mood, aggravation at afternoon, especially at 4 to 8 p.m. evening, characteristic mental generals. Restlessness and nervous at evening during 4 to 6 p.m., characteristic mental generals. Difficulty in concentration, it is a common mental generals because it is a confusions and difficulty in your daily routine work. It is a common major depressive disorder symptom. So we can classify into the common mental generals. Confusion of mind at evening, which is specifically confusion of mind at specifically at evening, which is characteristic mental generals. Then lack of self-confidence is very most common. And the thoughtful, too much of thought because of depressions, power of love, which is characteristic mental generals, intolerance of contradictions, characteristic mental generals, sensation of fullness after eating, which is characteristic physical generals, because this fullness is patient is having a ravenous appetite, eating a full meal after eating a meal, and then he has a sensation of fullness. Analysis of case. Ameliorations by irritations, which is characteristic physical generals. Pulsating type of pain in head, characteristic particulars. Headache ameliorates by external pressure, which is characteristic particular. Ravenous appetite, eating increase the hunger, characteristic particular. Sleepless midnight after 2 to 2:30 a.m., characteristic physical generals. Amorous dream is characteristic physical generals. When moving forward for evaluations of symptoms, weeping tearful mood, which give a higher marking because there is a special timing of evening. And then restlessness and nervous at evening during especially evening time 4 to 6 p.m. Confusion of mind at evening, difficulty in concentration, sadness, changeability in mood, thoughtful, power of love, amorous stream, lack of self-confidence, intolerance of contradictions, ravenous appetite, sensations of fullness after eating, ameliorations by irritations. Then our totality. Weeping, restlessness, confusion of mind at evening, difficulty in concentrations, changeability in mood, thoughtfulness, power love of, amorous dream, lack of self-confidence, intolerance of contradictions, ravenous appetite, sensation, fullness after eating, ameliorations by irritations, sleepless midnight, pulsating type of pain, headache, and then we moving forward a repertorial totality. So the first rubric is mind, sadness, morning, whacking on. We use the canned repertory for this case. Mind whipping, afternoon, especially at 4 to 8 p.m. Restlessness, we can found in mind chapter restlessness evening at 4 to 6 p.m. Mind confusion evening. Mind concentration difficult. Also find in mood mind chapter mood changeable. Thoughts in mind chapter persist. Also mind chapter power love of. Confidence want of self. Contradiction intolerance of. Stomach appetite increase eating after. Fullness eating after. Irritations amelioration. Sleeplessness midnight after 2 a.m. Sleep dreams amorous. Head pain pulsating. Head pain pressure amelioration. And here it is our repertorization chart, which is using a radar 10 and with canned repertory. Here you see the list of medicine of analysis of result like lycopodium, sepia, phosphorus, lachesis, nuts vomica, silicia. And here is our rubric. Moving forward for a remedy selection. First, remedy selection for the patient is the lycopodium. Prescription lycopodium 1 mg single dose and cyclac, rubrum 4 pills TDS for 15 days. And we give a general management and auxiliary advice is to get a proper rest, try a gentle exercise like walking, swimming and yoga. Spend time with friends and find a support group. Try writing your feelings in a journal. It can be a great way to release a negative feelings and put them into the perspectives. Don't make any major life-changing decisions while you are depressed and talk about any life-changing decisions with your family and friends. Do meditations and yoga. Here I want to say everyone, when we are dealing with such type of major depressive disorder patient, we have to counseling them, understood the patient's problem, counseling them, and give the advice to relax their mind. Don't think too much, don't panic. And if they panic and anxious mood, then don't take a life-changing decision. Because if that decision taking on panic situation, which may regret in further in life. So we can give the advice to a patient, be calm and composed. If you have a doubt and confusions, then talk with your family members, friends, and your close friends. Here is the progress record of patients. After a giving of 15 days, patient feels much better in previous complaint, decrease the intensity of all the symptoms. So we can go with the cyclic for 15 days. After the retaining of 15 days, patient has an intensity decrease, but all the symptoms are still persist. So that's why we again repeat the lycopodium 1 mg single dose, and after 15 days, patient come back again and feels much better, occasionally feels sadness, mood changeable, no any other complaint. So it's a good sign, ameliorated all the complaint. So here we wait and watch for further improvement. Again 15 days give the Saclac and again patient for 1 month. Sorry, I can give a patient medicine for 1 month, and after 1 month patient came and the feels much better, really rarely feel sadness, slight thoughts, mood slightly changes, otherwise no any major complaint. So again give 1 month Saclac, and after patient coming back after 1 month, complaint reduced and patient feel better. So here, no repetition of dose is needed. The Hamilton Depression Scale before and after treatment, doing the before score is 14, which is classified in moderate major depressive disorder, and here after our treatment the patient has a 4 Hamilton Depression Rating Score, which is under a normal range. So here we do a case discussion. What is the case about the loss of power and the presenting complaint depression 1 year, and what is the core conflict of the patient, which is I lost my power of my positions, I want power, intolerance of contradictions, and fear of losing social position. Here what we do as a homeopath, we cannot go for the metaphorically diagnostic criteria of symptoms. We go for the what is the actually patient feels and what are the conflicts which is that's why the patient has suffering from the major depressive disorder. Here is the key modalities of the time aggravations, physical concomitants, and generals. So what is the repertorial insight in this? The repertory help to decoding the case. First is a mental core. Why is the most important question. Why this patient suffering from the major depressive disorder? Here is the core feeling and conflict, power, love of power, contradiction, and confidence. And the another when it happens, specially it happen in a whipping mood, especially at evening, restlessness at evening, right? And physical confirmations is stomach appetite increase eating after, fullness eating after. So here we can see the case is follow the advisory philosophy of Dr. James Tyler Kent, mental generals, physical generals, and particulars. So we can consider patient as a whole and make a totality, then doing a repertorization and give the simillimum of the patient, and it gives a wonderful result in our practice. So the prescription is lycopodium 1 mg because high potency is due to the prominence of mental symptoms in frequent repetitions, right? And we can see here the April, May, and June and August patient is asymptomatic, and the objective evidence on Hamilton Depression Rating Scale is dropping from 14 to 4, right? And here is the conclusion. The path a key to the recovery. Totality is key. The success came from matching the mental symptoms with the physical generals. Beyond the suppressions, this remedy didn't suppress the sadness. It restored the patient's capacity to handle his reality. In the specific rubric, it transformed a complex case into a solvable equations. So the final verdict is a lycopodium restored the balance from darkness, which is loss of position, to the light, restored the confidence. Here we moving forward for a case 2. Here we case a 36-year-old female patient, studied a PCOM, and she is homemaker, came with the complaint of depression since last 2 to 3 years. At present, complaint increased since 2 months, having the complaint of sadness all the time, lack of interest in any pleasurable event or activity, doesn't like to do work, don't want to talk with anyone, especially my family members, feels good when alone. I used to be lot anxious about my health. So many thoughts in mind, can't sleep after the 3 a.m. in morning and feels more restless at night. She came with this complaint. Here in this case, no any associated complaint, but past history, 3 years back, she has done a hysterectomy. After that, gradually started all the complaints, taken a treatment from psychiatric, improvement in condition, so stopped taking medication in last 1 year, but last 2 months started the same complaint again. The family history, father and mother both are alive, but mother having a hypertension and her grandfather had a hypertension, but he died not present and is natural death. The personal history, appetite is wanting, patient is thirstless, stools okay, urine craving not specific, thermally patient is chilly, sleep is insomnia after 3 a.m., dreams not remember, perspiration at night which is moderate, no addictions, which is housewife, middle class family, and good marital relations. Obstetric history is a 2-fold term normal delivery. Is a hysterectomy done before 3 years back, the life space. She says I am the first child of my parents, belong to a middle class family. Childhood was normal like other children's. Good in study, easily got job, doing too good in job, get married at 28, living happy married life, having two children, and after that he left her job and everything was good. But in last 4 years ago, I had some dispute with senior in company and I lost my job. I got another job, but due to that, I lost my power of position and I can't handle it. Patient is conscious, sad look, and lean and thin, 5.4 height, 55 kg weight. There is no any abnormality detected. Systemic examinations were normal. The physician observations during the case taking. Weeping while telling her symptoms, look sad and anxious. Laboratory investigation not needed. Provisional diagnosis is major depressive disorder. Differential diagnosis is major depressive disorder. And the final diagnosis is moderate major depressive disorder, which is based on Hamilton Depression Rating Scale. Here, we consult these patients. She has a Hamilton Depression Rating Scale, which is 16, which is classified under a moderate major depressive disorder. Moving forward for a case procedure. Analysis of case, sadness all the time, indifference to everything. While during the case taking, she says, I cannot do anything, any household work, anything. Amelioration while alone and doesn't like company. Anxiety about health. I can tell you one story. She's tell me that I loved my husband, my children's, but I can't like their company. I cannot stay without any anxiety about them. I can always anxious about my children's and my husband, but I also don't like them. Then restlessness, aggravation at night, too much thoughts, aversion to family members, consolation, aggravation. When I tell someone I have this complaint, I am suffering of these, and if anyone sees me, it's okay, it's happened, then I don't lie. People give me a sympathy. Dwells on past and disagreeable occurrence, religious affections, weeping when telling her sickness, patient too much crying, weeping in front of mine, analysis of case, diminished appetite. She has a significant weight loss, 4 kgs in last 1 month. Evaluation of symptoms, the aversion to family members, company aversion to, amelioration when alone, dwells on past disagreeable occurrence, indifference to everything, consolation aggravations, weakness of memory, religious affections, insomnia midnight after, restlessness at night, anxiety about health, sadness all the time, so many thoughts, weeping when telling her sickness and appetite haunting. Moving forward, a totality of symptoms, aversion to family member, company aversion, and ameliorate when alone, dwells on past disagreeable occurrence, indifference to everything, consolation aggravation, weakness of memory, religious affections, insomnia midnight after 3 am, restlessness at night, anxiety about health, sadness all time, so many thoughts, weeping when telling of a sickness, appetite haunting. And we moving forward for repertorial totality. Mind aversion, members of family. Company aversion to amelioration when alone. Mind dwells on past disagreeable occurrence. Mind indifference, apathy, everything to. Consolation, aggravation. Memory weakness of. Religious affections. Sleeplessness midnight after 3 am. Restlessness, nervousness at night. Sadness, mental depressions. Thoughts, thoughtful. And the weeping, tearful mood. That is telling her sickness, van. Stomach, appetite, wanting. And here it is the repertorial chart doing in radar 10 with the cant repertory. Here we can see the lots of medicine are coming in differentiation like the sepia, sulfur, lycopodium, calcarea, natramure, ignatia. Moving forward, the remedy selection is sepia. The repertorial result is sepia covered 34 symptoms out of 13, and the sulfur score is 22 out of 10. And the final prescription is sepia 1 m single dose and the Saclec TDS 4 pills for 15 days. We give this patient advice to get a proper rest, try a gentle exercise like walking, swimming, and yoga. Spend a time with friends and find a support group. Try writing your feelings in a journal. It can be a great way to release a negative feelings and put them into a perspective. Do meditations and yoga. So here is the progress record of the patients. After 15 days, patient feels better in all the complaint, reduce the intensity of sadness, weeping, dwells on past, restlessness, thoughts, and improve sleep and appetite. So we can give a Saclec again for the 15 days. After 15 days, patient improve in all complaint, but still persists the complaint. Intensity is decreased, but also having the complaint present in his body. So again we repeat the sepia 1 m single dose and we put the patients on wait and watch and repeat the Saclec. After the 1 month, patient feels much better in all complaint. Again give the rubrum for 1 month. Patient came, improvement in all complaint, no sleep disturbances, memory improves, and no needed of any repetitions and medication at this point. So we can prescribe a 5-term 30 continuation. Here I remember one thing, patient tell me, doctor, before I forgot the things on stove which I put for cook, and now I remember exact what things I put in my which cupboard. This is very good improvement of patients. Next, Hamilton Depression Rating Scale is decreased from 16 to 4. Here is the discussion. I gave this case a silent sacrifices. She tell me while a case taking, I do a lots of sacrifice. I had a job. I have my personal identity, but I left my job due to my family, my children's, my home. And now what I get, this is very much hurtful for me. So I give on this base, this case name is the silent sacrifices, and it is frequently happen in a homemaker, which is we cannot consider them or any never grateful for them. So the onset of depressions following the hysterectomy. Here is the specifically after hysterectomy, because artificial menopausal developed because the hysterectomy removed the uterus. Then patient's profile 36-year-old, and the like a first case, here is the narrative of why this female is suffering. Then she says, I have done lots of sacrifice, not give much appreciations. I don't like my family members. I feel good while alone, and I hope people who give me I hate the people who give me a sympathy. Here is the key mental symptoms is indifference, total lack of interest in pleasurable activity, aversion, especially the family members, husband and children's, aggravations, consolation causes anger and company is intolerable. Physical complaint, insomnia after 3 a.m., chilly patience, appetite, wanting. Here is the repertorial insight is a differentiating the remedy. It is the decoding the rubric. The core rubric is mind aversion, members of family, consolation, aggravation, indifference, everything to, dwells on past, disagreeable occurrence. And the physical examination, sleeplessness midnight after 3 a.m., female hysterectomy, ailments from. And the repertorial result, sepia covers the totality, 34 symptoms out of 30. And the differentiation is unlike natromure, who walls off but cares deeply. The sepia shows a true indifference and exhaustion of affection. At some point, I feel this lady is somewhat like I give a natrum, but she is not natrum because natrum has a deep connection with family. Natrum has the importance of relation in life, but sepia has a true indifference and exhaustion of affections. So that's why here we consider patient as a whole, mental general, physical generals and particulars. So here the core feeling of mind, body and soul. And so we can get the medicine is sepia. Summary of this case is a sepia 1M, the rational high potency for deep-seated mental and emotional pathology with clear separations. The timeline of recovery in January 11, January 25, 25th Feb, and May and April, patient become asymptomatic, memory improved, no sleep disturbances, and objective evidence is dropped Hamilton Depression Rating Scale is 16 to 4 within a normal range. So here is the conclusions. Restoring the vital flow. The shift. So indifference and stagnation, it is the darkness of this case. And we put the light with engagement and flow with the help of our homeopathic remedy, individual remedy, which is sepia. And the lesion is the case involving hormonal separation because of hysterectomy, caregiver burnout, and the look for the loss of affections. So that's why we prescribe the sepia. Repertory as a guide, it helps us a value aversion to family overcome a sadness, leading to the correct simillimum. Here, here we can discuss. As a homeopath, we can find what is the darkness in depression in patients and what we can do, as Dr. Samuel Hahnemann said, in case taking, steps of repertorization, defining the problem. This defining the problem is a darkness. We have to identify, and we identify this problem, we can easily solve with our individual homeopathic medicines through understanding of the psychology of patient, what is the affection in the patients, like questioning why this happen, when this happen, whenever it happens, what the patient thinking. This all the question, put a line and make a clear picture of three axes: mind, body, and soul, which is said by a Dr. James Tyler Kant. Thank you, everyone.
Thank you, Doctor. Excellent presentation.
Thank you, sir.
The two cases itself, you point out the beauty of homeopathy. You narrated the cases well with the exact simillimum medicines. You unravel the cases, freed the patients back to normalcy. And you can add more if you need to.
I just want to share with here is the many more senior practitioners are here, but I want to say especially about the student. They hesitate to take such kind of cases. I'm a professor in college, so I'm seeing OPD. But when students are here with me and they said, how we can take the case, ma'am, case taking, how we do. So I try to explain normalize what we have to take and what we have to identify in the case, which is said by Dr. Samuel Hahnemann in steps of repertorization, decoding the defining the problem. So we have to defining the problem and decoding with the rubric, with repertory, and we find the rubric and go with the repertorization. It's just a mathematical and prescribe the medicine. That's it. And if you have a doubt, then refer the materia medica.
Usually, these type of cases slide to these one-sided diseases. If we are only considering the mental generals only, and you took the whole case and took the rare peculiars and generals and all, and also you mentioned how you tackle the cases. It's very interesting, and a lot of persons are here to join, and it's time for the discussion. I welcome Dr. D.N.H.E to start with. So please.
Yes, Doctor, it was really an interesting case, not simply interesting, but it is full of scientific. You have shown the beauty of the science of homeopathy. That's what I must say, because we used to say that homeopathy is the pure science among sciences, because we have certain protocols how to take the case and what are the things to be done, what are things not to be done, and how one need to interact with the patient, and one how you can differentiate each patient from one-to-one, even though they are having same disease. That is the individualization. And if your interaction as well as your observations are right, you will be able to find the right remedy. But simply going with the right remedy, you may not get the result, but it is an art how to apply the medicine. Then only it works. And that's the reason why you got success in both cases. And your repertorial method was really excellent, choosing the symptoms in a different way, giving more importance to the mental symptoms. Of course, physical symptoms need to be looked, but if you have the right symptoms in your from the mind of the patient, you can choose the right remedy. Then it becomes the medicine, and it will works, and you will be able to get that cure in the shortest possible time. Anyway, congratulations. I would like to announce a few things in front of you.
Yes, sir.
Yes, all of you know that IFBH is about to reach 2,000 days within some 20 days from now. And not 20 days, just some, yes, 22 days from now. And we have decided to go with celebration from next Sunday onwards in a big way. Our first celebration, that is the inauguration of the same, will be happening at Kovalam, Trivandrum. There is a big hotel, and not the hotel, it is the place where Professor Jose Isaac is running a medical classes for Western doctors. Already there are 25 doctors from Russia, Ukraine, Uzbekistan, Hungary, and all. So we have decided to conduct our first celebration there itself. And nearly 9 Western doctors are going to present their papers there, and some 4 Indian people, Indian doctors, particularly they are from Kerala, are about to present some papers also. One house surgeon has given an opportunity also. So that means we are about to begin the celebration from Kovalam, and we will be ending our celebration of 2,000 days at Bangalore at the last week of April, most probably last week of April. That means we will have to get different categories of people. As you all know that IFBH has more than presentations from more than 65 countries, doctors as well as eminent personalities. And this time we got an opportunity of getting this much of doctors here in Kerala. So we are doing it a big way, but in a short notice. That's the reason why we couldn't inform you earlier. But we have decided to go in that way with a short celebration. To Dr. Bindra to elaborate something more on that.
Thank you, Doctor, for the announcement. And IFPH is a vast floor of like an airport. We are making a lot of things to happen. Daily knowledge explosion is happening here. And it's very wonderful that we are going to host this 2000-day celebrations on Kovalam. And it's great. And I think we need to go back to Doctor itself, because she is very keen and enthusiastic. And the way how she differentiated the second case from Natramur and Sepia, I thought it might be Natramur. In the initial time, I was thinking like that, but the patient was chilly. And how she differentiated the case was also excellent. I think Dr. Rampravesha need to say more. Let me welcome him, please.
Thank you, Dr. Bindu Raji, and everyone. Namaskar and congratulations, Dr. Harshna Goti. Very on your wonderful presentation. Depression case and second presentation select the remedy. CPI is very good according to repertization. And homeopathic is a science, that art of the science. Select homeopathic
Yes,
is the art, then science. So rubric selection and repertization is the very good. CPI and differential CPI and natural very good. CPI is a cold remedy, a depression. CPI is congratulation, aggravation. So very good presentation. Very, very thanks, Dr. Harshna Goti. Thank you.
thank you so much, sir, for your wonderful words. It's a inspirational words to do a more hard work in homeopathy, and we are here to bring a highest peak of our homeopathy.
Homeopathic is the broad science
Yes, sir,
treatment, in
definitely.
visualization treatment. Whole mind, soul, and mind, soul, body, in visualization treatment.
Yes, sir.
Individual treatment. So
Thank you.
homeopathic, the great science, first grade of science.
Thank you.
Not second grade of science, first grade of science. Thank you.
Thank you.
Thank you so much, sir.
A few more minutes to go. Doctor, you can say some words to the students who are listening this session.
Yes, I would like to share with the student, don't be afraid doing a homeopathy. Take a case. First, the first and second year student, I will advise them to take a case, do mistake, and learn from your professors, doctors nearby, practitioners nearby, learn from them. And I would like to say, learn from everyone. Even patients sometimes teach us a medicines very wonderful way, which Materia Medica can't explain in while reading, but patients can do. So observe. I would like to say, being a keen observer. Observation is the key. As a repertory professor, observation have a very keen. Then you have to find a definitely rubric and hit the target. Definitely. And I would like to thank all IFPH talks organizations and who give me opportunity to take a live webinars on that. Thank you so much, everyone.
Thank you, Doctor. And it's time to conclude. So on this IFPH forum, we are very keen to see such faces, very enthusiastic, very much energy-filled doctors. We need to be again back. You should come again with more cases, more presentations.
Definitely, sir.
For your session. And on behalf of IFH, I thank you, Doctor, for this wonderful.
Thank you. Thank you.
Thank you so much,
Thank
sir.
you. Ghar ghar homeopathy, har ghar homeopathy. Thank
Yes,
you.
sir. Gargar homeopathy.
Har ghar homeopathy.
Yes, sir.
Thank you all who were presenting here for the session. And I think it's time to start the Malayalam. Over to Dr. Shaila for the Malayalam session.
Okay. Thank you, sir.
Dr. Thanesh, you can add more about these 2000 day celebrations if you need to.
Yes, definitely. We need more participants from all of you because we will this time this will be a short one, but the next time we are doing it in Bangalore. Hope all of you will come over there to celebrate these days because this is a history. There is no such thing called 2000 webinars continuously. That in three languages, and we have our Hindi team also doing more than 1,025 or 50, I think. They are nearing 1,050 days now. So simultaneously, the Malayalam session is also going in a good way. That's the reason why we are getting support from all of the, but unfortunately, the number of subscribers is not improving. Already we have uploaded more than 3,500 videos on YouTube. I hope all of you will share it and you will subscribe it. There is no fees for subscribing our videos. We are uploading our videos on the very next day itself. You can get the video of today's session tomorrow at exactly by about 6 p.m. Definitely, you can subscribe. We are requesting all the students to subscribe the same. You can share it with your friends, not only to homeopathic students, but also to your friends and homeopathic lovers. Uh, the purpose of this forum is to take homeopathy to every home around the world. And that's the reason why we are conducting celebration. We are showing the world that some people used to say that homeopathy is banned everywhere, but it is not the case. Most of the doctors, most of the persons who are there in Kovalam are postgraduates in the modern medicine. They are studying homeopathy because they know that homeopathy can do wonders because it's the pure science. So that's the reason why we are here to celebrate our session on from this coming, that is on the 8th of February from 10 a.m. to 5 p.m. Hope all of you will join us in a different way also. Even though you are not able to come over here, we will upload the videos for you people to watch. And the most of the doctors are from Russia, and that is one of the most important point. That people believe that there is no homeopathy in Russia or some other part of the world, but it is not like that. Everywhere, homeopathy is everywhere. They are coming, not simply a layman is studying homeopathy, but postgraduate doctors from allopathic side are studying. So we will have to. That's the purpose of this celebration. We want to show the world that homeopathy is practiced all over is being practiced all over the world. Anyway, thank you, Dr. Bundiraj, for giving an opportunity once again. Over to you.
Thank you.